Ignition. Liftoff.
As Healthwatch Essex, we've decided that taking part in the NCS programme would be a great way for us to speak to hundreds of young people from all across Essex in one place, in an environment where they already feel comfortable to open up and share their experiences around health and social care.
It's important for our voices to be heard because it's our experiences.
And so that we can all have our own opinions put in, so you can get it from all different age groups.
We'll probably use the hospital a lot in the future.
I mean, at the end of the day, we're going to be the ones paying for it when we're older, so they should listen to us.
Because we're obviously still growing, and this is quite an important time in our life. If there's something that we think does need to change, then I think that's one of the things that should be addressed.
If the young people are being heard, then maybe they see that the healthcare is a good career choice, and maybe they would like to get involved.
With young people, there's needs about getting information because a lot of them are coming to the age now where they need to make their own social care and healthcare decisions.
So for example, this Healthwatch thing, this has been really good because it gives us a chance to say what we think, and I think it probably helps people get a little bit more involved.
Is the fact that the young people can share their opinions and they feel that they're being listened to and they can follow it up and find out what happened. I think that's really valuable.
So it's about finding out about what information they want from services, how they experience services, and also any work that we do that might influence how services are shaped or run.
Yeah, I mean, I didn't really know what a walk-in clinic was. Like, I'd heard of them, but I didn't know exactly what they did, and I didn't know what 111 did. So it was quite interesting learning about the various facilities that are provided to us.
Yeah, for me it was an opportunity to get to know the NHS and what they do a little bit more.
In the future, we'll be more aware of how to get treatment issues such as mental health, social care.
They said things that we didn't even know about, and so we took a lot in.
We've really focused in on some different areas of health and social care this year, such as mental health, urgent care, and what they know about social care and social services.
And my gran had dementia for the last 5 years, so yeah, obviously doctors helped gave her medication, and we had to care her for last year and a half before she passed away.
So I don't think that schools do enough, and they leave it as quite a grey area, especially around mental health issues.
A lot of them struggle with mental health because they said in schools there's nothing to do with mental health, they don't talk about it.
Well, it's always been quite surprising just how open and willing to share the young people are, which signifies to us that they all have experiences already at this age, they all have opinions about the kind of care they'd like to receive, and that there's a real desire to have those opinions used to make a positive change.
Just sometimes you just keep things and you don't really talk about them, so it's good for it to get it off their chest and get their point of view across and how they want things to change in the future.
The young people that we've spoken to have been really inspirational to us and the direction that we take our work. Often young people are dismissed as a group that don't want to engage, they don't have enough experience yet, so what could they contribute? And we find that even when we speak to them and they say, I haven't had a huge amount of experience, they all have something that they can share with us that has a big impact in our work, and it's really valuable listening to them.